My name is Jessica Nelson. I'm going to be demonstrating how to perform a musculoskeletal exam. So to begin, Trent, my name is Jessica. I'm going to be performing your musculoskeletal exam today.
Okay.
All right. So to begin, I'm going to be talking to you and to the camera so that others may learn from this experience. So to begin with your exam, we're going to be inspecting, palpating, checking range of motion, and muscle strength of your limbs, okay? All right.
Sounds good.
So to begin, when you have a patient walk in to your office or area that you're going to be doing the exam in, this is when you can check for their gait, the range, their base of support. But since Trent is already here, we're going to have him stand up. Okay. So when your patient stands up, you're going to be checking their feet. And I know you can't see Trent's feet right now, but you're checking for the base of support. So what you're checking for is, do they have one foot in front of the other? Are they imbalanced? Are they putting more weight on one foot? You're also checking for the feet. So you're looking at the alignment of the feet. Are they straight? Are they turned out? Are they turned in? And you're also checking for their gait next. So Trent, what we're going to have you do is we're going to have you walk to the wall and back. So when they're walking, you're checking for any like walking on their tippy toes, you're checking for any imbalance. You're checking to see if they can like bend their legs as they're walking, or are they stiff, or are they imbalanced, are they walking on their heels. You're checking for their gait. Also, while they're up, you can check for their cerebellar function. So for this, you can do the Romberg test. For the Romberg test, what we'll have Trent do is put his feet together, and we'll have him put his hands to his sides, and then we'll have him close his eyes. And what you're looking for is if Trent starts to sway, and you do this for about 20 to 30 seconds. If they do start to sway and lose their balance, this would be considered a positive Romberg test. But Trent isn't swaying, so we'll have you open your eyes again. And also for this cerebellar function, what you can do is you can test for rapid alternating movements, like with their hands. You can check for the finger to nose test. And you can also have them, when they're walking, you can have them do the heel to toe as they're walking. But for now, we're going to have Trent turn to the side, and we're going to check his back. So I just do this when they're already standing up. With the back, what you're inspecting for is any lesions, bruising. You're noting the skin color, and you're checking for the vertebra. So we're going to be palpating, and you're going to check for each vertebra of the back. So you're going to go from thoracic to lumbar. And Trent, let me know if there's any tenderness.
Nope.
Okay. So also you can check for scoliosis. You're checking for the alignment of the spine. So Trent, I'm going to have you bend over. And as you're doing this, you're noting the curvature of the spine and making sure that there's not like any swiggles. And so this would be also, you're checking range of motion, which is the flexion. So Trent, I'm going to have you stand back up, and I'm going to have you do extension. This is Trent leaning back, and then we're going to have Trent stand up, and we can have him turn to the side. So next we'll have you do a spinal rotation, just turning, and then we'll have you do lateral bending. So just from one side to the next. Now, when checking range of motion, if for some reason the range of motion is decreased, you can check the angle with a goniometer. So Trent, we're going to have you sit down now that we've inspected the back. All right. So next, we're going to check for his neck. So with the neck, we're inspecting again the skin color, noting any bruising, and we're also looking for any lesions, anything that sticks out to you that seems to be abnormal. So also we're going to palpate the neck. So Trent, we're going to be palpating the joints Tell me if there is any tenderness.
Nope.
Okay. All right. And then while we're here, we can also check out the range of motion. So Trent, what I'm going to have you do is I'm going to have you flex. And then I'm going to have you extend it backwards. All right. And then I'm going to have you do cervical rotation, just turning, and then lateral bending. All right. And then you can also check for the strength of the neck. So what we're going to do is we're just going to push down. We're going to have Trent push against my hand. Same with this side. Okay. All right. So that's checking the neck. We can move on to the shoulders. So with the shoulders, again, we're inspecting for the skin color. We're noting any bruising, any lesions, any scarring, and then we're going to be palpating. So we have the scapula and the clavicle that we're checking, and we're palpating over the joints. And then Trent, tell me if there's any tenderness.
Nope.
Okay, and we're also noting if there's any nodules that are sticking out. All right, and then we can do the range of motion. So with the range of motion, we'll have Trent, we'll do this bilaterally with both shoulders. You should always check everything bilaterally. So we'll inspect this side as well. Inspecting and palpating. Is there any tenderness on the side?
Nope.
Okay. All right, and then we'll do a range of motion with both shoulders. So we'll first do flexion, and then extension. All right, and then we're going to be doing abduction and adduction. So abduction is where you're bringing your arm out, and then adduction is when you're bringing it in. So adding to your body. And then we'll do internal rotation, which is where you bring your arm back like this. And then we'll have them do the next side. So internal rotation and then external rotation. And then this is when they're almost like a chicken wing that you're doing. And we'll check on the other side. And while they're doing this, you're noting for any crevitus as well. So next we're going to be moving on to the elbows. With the elbows, what we're doing is inspecting, again, for color, for bruising, for nodules that are pronounced, and palpating as well. So let me know if there's any tenderness.
Nope.
Okay. All right. So then we're going to be doing flexion of the elbow and extension. And then we're going to be doing with the elbow, you can do pronation and supination. So pronation down and then supination up. And I always like to say with supination, it's like holding a cup of soup in your hand. That would, if you weren't able to do that, then it would be pronation because it would all spill out. With that, we can, while we're here, we can check for the strength of the biceps and the triceps. So I'm going to have Trent hold in this position, and I'm going to push down while he pushes up. And then down for tricep, and then up for bicep, and down for tricep. So with the strength of, when you're checking for the strength of the muscles, what you're ranging them off of is like 0 to 5. So 0, no muscle strength, to 5 plus normal strength. So then we'll be moving down to the wrists. So checking the wrists, I'm going to have you bring your hands up like this. So checking the wrists, we're inspecting for any bony prominences that are sticking out, any nodules, any inflammation that is showing, any bruising, And we're also checking that the joints are formed, that there's not any breakage occurring. And then Trent, we're going to be doing range of motion now that we've inspected, palpated. So flexion, and so flexion, you'd be grabbing down, and then extension. And then you're going to be doing adduction. So that would be turning in. Your wrist would be adduction, and then abduction would be turning out. So then with your fingers, we'll be moving on to the fingers next. You're going to be inspecting the joints of each of the fingers. And you can be with your patients, you're also looking for signs of arthritis. So for any inflammation, any tenderness, Trent, let me know if there is any tenderness in any of these joints, okay?
Okay. No.
Okay. All right, so with the fingers, you're gonna do flexion and extension with the fingers, and then you're gonna have your hands straight out, and abduction is extending your fingers and adduction is bringing them in. So then we're gonna test the muscle strength of the fingers. So I'm gonna try to pull your fingers apart, but don't let me. And then I'm gonna have you extend your fingers and don't let me push them in. All right, and then put those in, pull out, don't let me do that. And then, yep, okay. All right, so now that we have done the top half, we would usually go on to the hips, but I'll do that next after I do the knees, since Trent is already sitting up. With the knees, what you're inspecting for is, noting the skin color again, noting for any bruising, any lesions, any scarring, anything that you would consider to be abnormal inflammation. And then we're going to be palpating the joints. So you can feel like the patellar right here. And Trent, let me know if there's any tenderness.
Nope.
Okay. And you can also check the size of the joints, and for inflammation, like if one was bigger than the other, but his is not. So next we'll check for range of motion. So with range of motion with the knees, first we'll have them do extension. So we'll have Trent bring his leg up, and then same with this side, and then we'll have him bring it down, which if you could just scoot forward a little bit more, then you could see them moving their leg back like this. Okay, all right. And then next would be abduction, which would be moving it away, and then adduction, which would be adding. Awesome. Okay, and then you can also check for the strength of the knees while they're here. So as they're doing extension, you can push down and they can be pushing up. And you also want to check this bilaterally. You want to know if one side is weaker than the other side. And you can also check this for during flexion. And always do it bilaterally, noting that the muscle strength for Trent is 5+. All right, so then Trent, what I'm going to have you do is I'm going to have you lay back and we're going to check for your hips, okay? All right, so when checking for the hips, you're still inspecting and you're still palpating the joints. So Trent, tell me if there's any tenderness.
Nope.
Okay, and I'm not noting any nodules or bony prominences that I'm concerned of. So next we would be checking the range of motion. So for the range of motion in the hips, we're first going to have Trent bring his leg up, which would be extension, and then checking the other leg as well. And then you're noting any like crepitus that would be occurring as well during this range of motion, or if there was a decreased range of motion, again, you would check with a goniometer. So while you're here, we can also check for muscle strength. So Trent, bring your leg up again, and I'm going to be pushing down. All right, great job. And that was 5+. And then this side was 5+ as well. So again, you're doing it bilaterally. I cannot emphasize that enough. All right, so next you would be checking abduction and adduction. So abduction would be moving the leg away from the body. And then adduction would be bringing it in, and you would be checking that side as well. So comparing left and right. So now that we have done extension, abduction, adduction, what we'll do is we'll have Trent roll onto his stomach, and we'll be checking for flexion. All right, Trent. So I'm gonna have you flex this leg up, and then the next leg as well, doing it bilaterally. And then we're gonna check the strength. So Trent, I'm gonna be pushing down while you be pushing up. All right, noting that this is 5+, and then same with this side, noting that this is also 5+. All right, Trent, you can roll back to your back. All right, so next, now that you've done, the hips, the knees, now we're moving on to the ankles. So with the ankles, we're inspecting again. Inspecting for the skin color, noting that it's the same as the rest of his body, Caucasian. Noting that there's no bruising, there's no lesions, there's no scarring. There's not any nodules that I see that are sticking out. So we're gonna move on to palpation. So palpating the joints, noting if there's any bony prominences sticking out, noting if there is any inflammation, noting if the patient seems in pain. So if there's any tenderness. So let me know if there's any tenderness, Trent.
Nope.
Great, awesome. So then we'll do the range of motion with the ankles. So we'll have him bring his feet up for extension, and then flexion would be bringing them both down. And then this would be turning them in and then turning them out. And then we'll move on to the toes. And with the ankles, sorry, it's inversion and eversion. So inversion would be bringing the feet in, and then eversion would be bringing them out. All right, so then moving on to the toes. With the toes, we're inspecting again the color, the joints, noting if there is any nodules that seem more pronounced than any others, especially checking them bilaterally. Any bruising, and then we're going to be also palpating for tenderness. So checking each side and each joint against each other. So Trent, let me know if there is any tenderness.
Nope.
Okay. All right, and so then we'll be moving on to the range of motion with these. So range of motion, you would have them flex their toes and then extend their toes, and then abduction would be bringing their toes wide as they can, and then adduction, bringing them in. Okay. And while we're here, we can also, moving back to the ankles, we can check for their strength by just pushing down while Trent pushes up. Same with this side, and you can also have them push down, push down. So now that we've done fully range of motion 5+ with his ankles, and we've moved to the toes, we're done with the toes. That is all I have for the musculoskeletal exam. Thank you guys.